If you've had a bacterial infection like prostatitis or a UTI that keeps coming back even after taking antibiotics, then this video is for you. I have at least 3 or 4 men every single month come and work with me and do my program with this situation. And we've seen really good outcomes, which is why I'm making a video on it. What I'm going to do in this video is talk about some of the medical approaches that you could consider and the deeper nervous system brain approaches that can help, because it's a combination of both, I think, that is useful versus just saying, well, completely ignore modern Western medicine and only do the mind, body, or nervous system oriented approach. Or also just doing antibiotics when they clearly haven't been working, right? There's something else going on here. And so what I found is we'll actually get really good outcomes. So let's get into it. So the problem isn't the infection, it's the pattern. Often there is an initial infection, there's a pathogen in the body, and then antibiotics could be used to help suppress that and significantly reduce that bacterial infection. Now, what gets more complicated is that we don't live life in a vacuum where we just discover there's a bacterial infection through a diagnostic test and then we're given a round of antibiotics to take and then it clears up. There are a lot of factors at play. There are stressors in our life. Our nervous system is in a certain state of regulation or dysregulation. There are a lot of things that play into the mind, body, immune system, the whole combination here. So what we need to realize is that if there's something that keeps coming back, it may not necessarily be some insane disease that can never be cleared out of your body. That's not necessarily the case. But there's a systemic issue that's allowing for an environment in which a pathogen can take hold and continue to propagate. It's that environment that we need to consider adjusting. So this inflammatory response in fighting off bacteria can lead to tension and urinary burning and frequency and other forms of dysfunction that are systemic. And so the bacteria itself could be also hiding in biofilms, as it's called, which is another aspect of this that we could take a look at, which again isn't some crazy impossible thing to address. But there can be deeper layers. The microbiome itself could have a big gut imbalance, which gets even more imbalanced after rounds of antibiotics, killing out a lot of the good bacteria as well. But it's not just about the gut, the microbiome, the pathogens. It's about our overall system and its balance and harmony. Because a systemic nervous system issue, being in fight, flight, or freeze, being in a state of anxiety for things outside of even this bacterial infection or the body symptoms, absolutely can produce an environment in which you have a weakened immune system response. Now, what could you try on the medical side? I imagine you've already done antibiotics, probably multiple rounds, multiple kinds. So I'm going to present a few possibilities that you can also talk with your doctor about. And the first would be biofilm disruptors and also pH support. So biofilm is referring to when bacteria hide in protective layers, making antibiotics less effective. So biofilm disruptors like N-acetylcysteine or serrapeptase or interface plus are potentials to consider here. On the other side, we also have pH balancing agents that can help out. Diamonose, potassium citrate, short-term alkalinization for burning, urgency relief. These are possibilities on the biofilm and pH support side. Another consideration is helping with circulation and anti-inflammatory support. So part of this is that the area doesn't get flushed with healthy blood and lymph. So quercetin, bromelain. We've got things like doing sitz baths or heat therapy, gentle movement and hydration, pollen extract. These are some potentials to help out with that aspect. And the last thing I'll point out on the medical side would be microbiome rebuild, because yes, you've wiped out good gut flora, and it can be helpful to have specific probiotics, fermented foods, fiber hydration. They're not really meant to be a replacement for antibiotics necessarily, but these are things to consider on the medical side that are chemical and that can actually help address the environment and flush out things beyond just the nervous system approach, which I'll go into now. This is about treating the terrain and not just addressing the bug. So the nervous system, the autonomic nervous system, which is controlling the majority of the processes in your body all the time. Things like the genitourinary system, gastrointestinal system, circulatory system, large part of your musculoskeletal system as well. If your body is in a state of danger, there's an alarm signal turned on. Maybe because you had an initial bacteria infection, and this bacterial infection created a lot of symptoms that were scary, and you were afraid that you weren't going to be able to have sex. You were afraid because you're having to pee all the time, burning. There's a fear response, and this can put you on even more high alert. So this can create neural circuit pain or neural circuit symptoms that are propagated forward even after the initial organic disease process has fallen by the wayside. Then you might think, why am I still getting, positive tests on these particular infections? The other thing to consider is the systemic weakening. Again, the immune system response has weakened. So on the one side, we talked about the medical approach, and of course, work with your doctor on that. But if you're living in fight or flight or freeze, if you're going and going and going, working 80 hours a week, or completely ignoring this anger or this sadness or this fear, these looming anxious thoughts, or just tremendous pressure that you're placing on yourself, maladaptive personality tendencies to be a perfectionist and to always strive, and whatever it is, right? These things that clearly create huge imbalances systemically that can also lead and propagate these symptoms, which that's often what's happening, I find, with my clients. You can't just ignore that. So again, we don't live in a bubble, we don't live in a vacuum where it's just like, take these pills and then I'm going to be perfect. By all means, take the pills first, go about your daily life, we're good. If it's not going away, if it's chronic, if it's recurring, there's something systemic we need to take a look at. And so what I guide people through are 3 steps, which is, well, sometimes 4, but let's just say 3 right now. And that's relax your nervous system. So relax, regulate. We're doing things like breath work, and we're doing things like yoga, and we're doing some meditation, and we're doing things that are different. They're helping to interrupt the patterns of the mind and the body. And then we go into reveal, which is revealing the root causes. What is really going on? What is your body trying to tell you? There's a message there. It's not random. So instead of going, just watching videos and getting on social media and working and never stopping, have you stopped to just sit for like 30 minutes, literally doing nothing? Most people don't do this anymore. It's in these liminal spaces of boredom almost, or of quietude, that you're able to actually get more closely in contact with emotions or fears or things that you've been running from, in a sense. And then release is that last step. How do you actually let them go? How do you let go of those bad habit patterns and let go of the emotions or the responses and the reactivity? And there's a way to do that. So ultimately, there's an approach to getting better. That's what I help people to go through. We do the physical side. We relax the pelvic floor as well. We do some things so that you know how to relieve the symptoms and be able to pee and get back to doing daily life. So physical therapy oriented things and approaches like that. And then we also do the systemic nervous system relaxation, regulation, and addressing the root causes so that your body just returns back to balance and harmony. It's always healing itself anyway. So if you'd like help with that, we have the Overcome 12-week program. That's literally what it's for. It's designed for people who are dealing with chronic pelvic and urinary issues, whether they're coming from recurring bacterial infections or from other factors. So definitely reach out if you need some help. I look forward to supporting you. Take care.